David, your study looked at more than 1,400 patients with coronavirus. What conclusions did you come to when it comes to using hydroxychloroquine?
Hydroxychloroquine and/or azithromycin was not associated with a benefit in terms of in-hospital death, nor was it associated with a benefit in terms of abnormal heart rhythm.
As we are looking at our society and racial inequality and racism, we have to talk about healthcare.
Racism in healthcare is not the avoidance of providing care, but it really is thinking about what does inaction mean. We all as a community really have to think about how do we internalize and understand our role in racism.
My name is Meredith Baranko, and I'm completing my PhD in epidemiology here at the University at Albany School of Public Health. I was involved in assessing racial and ethnic disparities using a COVID-19 outcomes continuum for New York State. Using previously published and publicly available data, we were able to identify where the disparities emerge.
Dr. Holtgrave adds, to avoid past mistakes in regards to reopening the country, ramping up testing and contact tracing will be key.
We need to be able to make sure we can get to everyone who's symptomatic, get to everyone who may have been exposed, and we're not quite there yet.
My name is Elizabeth Rosenthal, and I'm a DRPH student at UAlbany. Over the past several months, I've been involved with coronavirus research. I assisted the State Health Department on a study on multisystem inflammatory syndrome in children. This study focused on patients' demographics, underlying conditions, symptoms, and health outcomes. This work contributed to a better understanding of an emerging syndrome in children linked to COVID-19. As a student, it was an excellent experience to work collaboratively with state and federal public health professionals as part of the rapid public health response to investigate the syndrome. I assisted the State Health Department on a study that provided the first information in the country on statewide cumulative incidence, along with details on disparities by race and ethnicity, sex, and age. This work identified important disparities in those infected by SARS-CoV-2 and demonstrated the need for continued public health strategies.
I'm going to ask our SUNY Albany Chief, Dr. Javidan Rodriguez, to head an effort to do more testing in minority communities now.
Cuomo says the state is going to partner with the president of the University at Albany and the health department to research why there are higher rates of COVID-19 among minorities and to increase testing in these areas.
We still have a responsibility to help protect older persons of all ages with underlying health conditions, and even increasingly we're seeing cases of this new syndrome among children.
For the School of Public Health, we've really been helping to design the system in terms of how do we design test kits, how do people enroll, how do we understand the data. All of that wraparound public health program has been sort of designed and is being executed with the School of Public Health.
In addition to that, I personally have been involved over the summer advising university leadership around what other things we need to do to make sure that people can stay healthy and come back to the campus. Mask policy, social distance in the classroom, all that is part of the important key to keep everyone safe.
I helped to assess the cumulative incidence and diagnosis of SARS-CoV-2 infection in New York. This project involved conducting antibody testing on a sample of New Yorkers, weighting the data so the demographics were representative of the New York State population by region, and adjusting it for sensitivity and specificity of the assay used.